Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
They're polite. I mean, they just take the time for you.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
I like the Angels for what they've done for me.
Angels Care Home Health. We serve patients.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching, and thanks to our producer, Jeff DeRoll. We're in the offices of outpatient therapist Ken Loos of the High Plains Mental Health Center at 208 East 7th in Hayes, talking about helping others and how it can dampen the effects of everyday stress. First, though, if you would, Ken, High Plains Mental Health Center, tell us about it.
You bet. High Plains Mental Health Center. We are the local and regional mental health center for Northwest Kansas. We cover 20 counties, all the way up to the Nebraska and Colorado border. We have our main offices in Hayes, but we also have 5 full-time branch offices, Mike, throughout our catchment area. And then many of our counties, we have somebody going out as a therapist once a week or once every couple of weeks. And so we try to provide comprehensive mental health services as close to home as possible. And last calendar year saw about 5,500 clients throughout the year. So we provide medication services. We have 24-hour emergency services, outpatient therapy, substance use services, children's services. Really are your comprehensive community mental health center.
Doing all of this, we might add, Ken, with diminishing support from the state, the legislature, and funding.
You know, funding is an issue for a lot of different agencies. Most of our funding comes from healthcare insurance, Mike, so just like going to a dentist's office or doctor's office, people's health insurance will pay for the services that we provide, Medicaid, Medicare, Blue Cross Blue Shield, and so on. And our counties provide some support, but you're right, on the state level, there has been probably for the last 6 to 7 years steady cuts in support, and that can make it a challenge, absolutely, particularly when you cover such a large geographic territory as High Plains.
Another thing I like about High Plains Mental Health Center is that it doesn't have to be a major event, a major stressor or change in life situation. Can be the small things that you and the outpatient therapist can deal with.
You know, I think that's an excellent point. A lot of times people will wait until a crisis occurs, or they'll wait until they're facing some kind of an emergency. And think about mental health, Mike, just as you would physical health, that the sooner someone notices a challenge, the sooner they come into an office like ours or go to their family doctor, the more options that may be available to help. And why wait for a crisis when you can really nip something in the bud fairly early? They estimate 50% of all mental health problems start by age 14, and 75% of all mental health problems are present by age 24. And you think about that 10-year gap. Now, that doesn't mean at age 14 it's necessarily full-blown, but if anxiety or depression or other challenges are starting to appear, you're going to start noticing those symptoms. And there are a lot of folks that suffer for 10 years or more when it comes to mental health before they seek out help. And our goal is, of course, to decrease that stigma and encourage people to come in as soon as they can.
Let's talk about the article from Science Daily, Helping Others, Dampening the Effects of Everyday Stress. You shared this with Mike and Boomer on the morning show. Share it with us here on Community Connection.
You bet. You know, this is one of these articles that it did not focus on individuals suffering from mental health problems, but they were looking at just stress in general. Did a little bit, it's a preliminary study, but they did some questionnaires, daily questionnaires to get a sense of stress that are going on in a person's life. And what they found, it's a correlation, which means there's a relationship, is that when you did little things for people, just little kinds of kind behaviors, keeping a door open for somebody. If you see someone struggling at the grocery store with a sack, offering to kind of help out. That we know with common sense those little things are good, but it's beyond just being a good or right thing to do. It also helps people kind of put their stress in perspective, and that people felt better by helping others. I know a big surprise for some, better by helping others than when they did not. And we're not, again, talking about big things. I think one of the things I appreciate about our meetings, we're not talking about dramatic life changes. We're talking about things that people can do on a day-to-day basis to maybe make a difference.
Each person can do, as a matter of fact.
Nicely
and it can
said.
start small and build from there.
Start small and build from there. I think we are really fortunate living in the Midwest, that a lot of people inherently do kind of have that desire to help others. They do kind of reach out to kind of be the polite, courteous individuals. But I think as Americans, because we're all busy, we're all stressed, we've got a million things going on in our head at the same time, that we can forget those little things. And it's just important as we can, take that opportunity to do something nice if you can. It could be giving somebody a compliment. It could be just doing something small and simple. But I do like what you said, Mike. This is something all of us can do.
Well, isn't this kind of built in with the golden rule aspect, Ken?
Yeah, which we forget about sometimes. We're not. Sometimes we blame our neighbors for everything rather than treat them the way we would like to be treated. And I think, Mike, the part of the problem is again, not just with mental health issues, but with stress, is that we can get so caught up in what's going on in our own lives and kind of what's going on in our own head that we forget to put that into perspective. And when you notice other people around you, if you're in line at a grocery store and someone's behind you with just one item and you have more, really it's not that big of a deal to offer to, let them go first. And most of us feel good about that, and I can guarantee the person with the one item feels good about that.
Sounds like you're speaking from experience here, Ken.
Maybe a little inappropriate self-disclosure, but really, you've got 100 things. I've got some milk.
In the line for the checkout of 22 items, right?
Right, in the 22 items, and
in the express lane.
And you have at least 44. I know there's 2 of you, but it's still not fair. It's just these kind of little things that we sometimes forget, and I think stress and certainly problems in mental health like depression as a challenge, people can get just so caught up in their personal struggles. They forget that perspective of doing something nice for others or kind of doing something for a bigger cause than just themselves. It's again, same kind of principle when we suggest volunteering for a church or a community organization or something that you're passionate about, to just kind of put your life in perspective. It's not all about just your immediate struggles and your immediate stress.
And speaking of the volunteer efforts, every time we hear feedback from volunteers, regardless of what area it's in, they say, I got as much out of it as I gave to it, if not more.
If not more, yeah. Isn't that a classic comment? And totally true. It's one of those things that when you look at people who volunteer, first of all, you're learning and you're growing, and we've talked before about how important it is to keep our mind active, to kind of push that envelope of comfort to try some new things. And isn't that amazing that you do something great as a volunteer and you probably do get back more just from your activities than what you're giving, and that's incredible.
Well, and there are a couple of aspects of the stress that you talked about, one of which is a physical toll that it takes on the body, not only mental health, but physical health as well.
Yeah, our body is designed that when we are threatened, when we feel that we need to take immediate action, and we can do something physically about that, that's one thing. But our body doesn't know the difference between an immediate threat, like you're driving your car and you're sliding on ice and you need to get control of it, it doesn't know the difference between that immediate threat and chronic stress, where you're worried about something constantly, finances, relationships, job, what have you, or that, you know, something else is going on in your life, going through a really difficult time. And so physically it does take a toll. It affects our immune system, it affects, you know, just across the body, our major functions, and it affects our mind, that exhaustion that we can feel, just that we are mentally spent. And so finding ways, and there's no, you know, when we see clients, Mike, a lot of people wish we had a magic wand or one suggestion or strategy that works for everybody. The science isn't there yet, probably will never be in my lifetime. But what we can do is talk about strategies, talk about things like doing for others, talk about having some gratitude, talk about just different things to try to kind of put your situation into perspective, and also to remind you that you have strengths, not just weaknesses.
And some of those things that relate to stress can go beyond that to interact with others. Road rage being one of the examples, perhaps. Others where things can escalate from a simple stressor to something that's more significant.
You know, our modern times has created situations like road rage, or people who say horrifically bad things online that they would never say looking the person in the eye. But there's something about when we think there's a little bit more anonymity. You know, when we're behind the wheel of a car, it's somehow that there's this buffer between us and another person. Talk about the opportunities, because we all get irritated, and whether it's online or driving. But talk about a great opportunity to take a deep breath, kind of ground yourself, bring it back into perspective. You know, this person driving 5 miles below the limit, or someone who cut me off a little bit here, we didn't wreck, you know, I'm still going to make it to work or make it home, just to really put that in perspective. They didn't do that because they're evil. They didn't do that because they did it on purpose just to hurt us. You know, there are times that we can just, and again, I think it's a factor of stress, everything can become about us, and that's just not accurate. That's just not true. We all know that, but you have to slow down, kind of take an inventory of yourself where you're at to bring back the reality and the perspective. And
maybe that's where you start putting a few more of those quiet moments in your life, maybe for reflection and concentration on the positive. Concentration on the positive, and what role can I change in something? You know, if road rage is a good example, if you're always angry driving to work in the morning, maybe what control do you have? How about leaving the house a little bit earlier so you're less stressed at the beginning? Because you're not going to be able to control who's in front of you at all times, or what light they're at, or which light turns red or green. But you can control kind of the attitude of going to work. Did I get enough sleep? And you know, these little things. And I think sometimes as Americans we feel, great, here's one more thing we have to keep track of. One more thing that I should do. Yeah, I should exercise, blah, blah, blah. But the point is, sometimes the littlest things, the littlest tweaks can have the biggest impact. And when it really comes to just perspective, what we can bring to a situation, I think that's a worthwhile moment of self-reflection. And certainly some of the things that we bring into our lives, whether it's negative influences from outside that we hear or associate with or are involved in, reducing those kinds of inputs and concentrating more on the positive or the outward volunteerism and outward signs can be helpful as well. Absolutely. You know, part of living a happy and productive and fulfilling life is to do things beyond just your immediate family. And that gives you such a wide opportunity in our country, you know, whether it is volunteering at a hospital or a library, whether it's volunteering to work with young children or the elderly, whether it's doing something for your church, whether it's doing something for a particular cause. You know, the bottom line is to be involved in things beyond just your immediate self, your immediate family, you know, be part of something bigger. Call if you just want to talk, right?
Absolutely, absolutely.
High Plains Mental Health Center, 208 East 7th, and outpatient therapist Ken Loos, our community connection.
Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
And the Angel Care nurse comes to see me once a week.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
Angel Care has helped to stay home.
Angels Care Home Health. We serve patients.